All right. So what's happening? Lots of people passed this week. Congratulations, and just keep it up with the good work, everyone. We have now two WhatsApp support system. One is for exclusively for the group, and the second one is for me to put out information just for you guys. Tips every day. I'm putting out bit pieces of information that will help you to quickly scroll down or scroll up when important information that other students said, hey, you should know this, and I think it's important. I'll go ahead and put it in one WhatsApp. You all should know this information if you are part of NP Exam Coach. So one WhatsApp only for me, so that way you can scroll down to 100, 150, 200 pieces of information, and you can easily look at it with the 5 minutes, scroll up and down. The other WhatsApp is for the students, right? Now we also have a live room. I'll be sending the code for you guys. So that is, if you want to do a study group, if you want to meet up with your buddy, it's open 24 hours. Basically, it's a chat group like this, but it's more customized. You have your own chair, whether you're looking at the beach or you're in the office, make it comfortable. So on this virtual classroom for you guys to hang out, there is a chat box. So that chat box never leaves, it never ends. So basically, as you write things there, then the other student can pick up where you left off and look at the information, right? Oh, 1 second, got disconnected. Okay. Oh, I got one. So chat that you can add some good information for another student or for yourself or for the person that you are studying with. The third announcement is that we have starting the WhatsApp providers that already passed. So that way, if you encounter a difficult patient, you can always reach out to me or to your colleague. So the main purpose of NP Exam Coach is to build a community that you can study together, pass the PMHNP board certification, but especially stick together for as you remain of your career. Passing the board is just the beginning. Believe me, I know that you might think that's the biggest thing, but that is the first step for your new career, for for that place that you belong and that you want to get there. So that's it. We had a small bug as of yesterday on our platform. It was fixed as of this morning. So if you go to all trainings, you should see all the trainings there. I know only half of it was showing up yesterday, but that has been fixed. Thank you for the student who called and mentioned to me. So I was able to fix it right away, and that's it. Before we begin, for you guys that are enrolled in a course, has anything came up to you this week that you'd like to discuss or talk about?
Yes, I have one.
Okay, please go ahead before we get started. Actually, give me 1 second. Let me help anyone else that has not been able to log in. I know we have about 24 folks, and only few of you guys have logged in. Who has not played Kahoot yet and would like some assistance? You have to unmute yourself. 1 second, Rebecca, and I'll get to your question while I'll help somebody out here. Okay. In the chat box here, I just finished. Okay, I'll answer that question in a second. So if you have not played Kahoot, you go on your phone to www.kahoot.it, not .com. KAHOOT.IT. Then it will ask you for your PIN code, which is 892657. 892657. 657. And then you pick your nickname. At this time, is anyone having difficulties logging in or don't know how to? All right. So I just uploaded maybe another 7 weeks of Kahoot into the course. You guys should be able to see that. If you're bored and you really want to watch the previous Kahoot, for some reason you couldn't, I is uploaded. I uploaded about 5 hours of one-to-one with previous students. As you guys know, I really don't stop until you pass. I'll do anything that I can for you to pass. So I have about 5 hours of rapid fire questions that I did with previous students that are just graduated, that just passed. So it is on module 10. It's open for you guys to look at it. Good, good information. If you are in a course, go to all trainings, module 10. There are about 4 to 5 hours of rapid firing questions. So all about PMHNP board certification, things that I think is must know between 2 or 3 different students that are just passed this week. I recorded their sessions. We spent a good time, about 5 hours. So you all should benefit from that, right? So now let's get started. Rebecca, you have a question, correct?
Yes, one of the people who passed this last week made their long list of everything you need to be sharp on, and one of
Mm-hmm.
them was Medicare Part A, B, C, D.
Say it again. It was what?
Medicare Part A, B, C, and D.
Yeah, that's something that I have on the question bank. Not very high yield, right? But I have broke that down in the question bank. In fact, someone just told me last week that I don't know, why do I need to know about Medicare part, A, B, and C. That's not relevant. That's not important. I said, well, it may be in one day. So there you have it. So we can cover a little bit more of that because it takes a little bit of more of I would say it takes a little while to explain it, and I want to do it fully. So we'll get back to that question in a second. But
Okay,
I
that's
do have,
okay. I'll
yeah,
find it in the question bank. Thank you.
yeah, yeah, several questions about Medicare A, B, C, and D. I was wondering when the question like that would come up on the board. So there you have it. You made me happy. That wasn't useless information. So great. Can you please repeat the code? Man, the code that is on the screen. Let me go ahead and repeat it. 89267. I mean 657. ADHD is kicking in here. And there's www.kahoot.it. You can use your phone to log in and then press on the phone for your answer. Okay. Paulette, you got it? So if you are, if you are in the course and perhaps you win today, it's $150 towards your next course that maybe the psychopharmacology course, which is a very comprehensive course. Or if you're not, you can use this coupon for any of our course. So make sure you take the first place. Make sure you tell me your name, email me, and let me know your situation so we can work something out. Okay. At this time, do I have anyone that would like to participate and have not been able to log in for whatever reason? Please tell me. It's okay. We have to wait the 5 seconds or 5 minutes. As long as I know, I can wait. I'm going to give you 5 seconds. You have to unmute yourself or put in a chat box that you're now ready. Okay. One,
Dr.
two.
Dr.
Go ahead,
Lopez,
please. Yes.
I am sorry I have to restart my computer, so I'm gonna say go ahead and I have to catch up later. It's close.
Okay. No worries then.
Okay.
Sorry. All right then. We're gonna get started then. Remember, how do you get points? You get points first for being correct, second for being fast. So you answer on your phone for being fast, right? You gotta answer on your phone unless if you have a touch screen device, right? So use your phone. use your phone to answer the questions. Man says, Dr. Lopez, please resend me the link to access the course. Okay, I'll do that. But please email me, okay? Because as I close here, this chat box is gone. I'm going to put my email address here, pmhnp at npexamcode.com. Email me. It's always the best way because WhatsApp, I do answer to maybe 50 inquiries a day, students asking questions. I may lose some information. So email, I always try to be on point on that. Okay. Okay. So we're about to get started. 5 seconds. 1, 2, 3, 4, and 5. Good luck, everyone. Let's let the game begin. All right, we have some answers coming in. We have 10 seconds left. All right. So as we have it here, right? In this case, if the patient is a danger to himself or to herself, then you must coordinate for inpatient admission. Involuntary hospitalization, in this case, is a possibility, right? Anytime someone might be at risk or the patient might be at risk to harm herself or himself, inpatient hospitalization is the best option. Okay. Next question. All right. Hopefully, everyone gets this question right. Very simple question. You should know the answer. All right. We have 15 seconds. Pick your best answer. And I want to see everyone getting 100% on this question, please. Let's do this, guys. Okay. Um, let's see what would be the best explanation, right? So, as a PMHNP, do you or you do not prescribe medication for mental health, right? So, explain the patient that as a PMHNP, they are qualified to prescribe medication for mental health condition would be the best answer, right? So understand that on the test, you may have other possible correct answer, but ask yourself what is the core of the question that match the answer. Okay? Remember that on Kahoot, I can only put certain amounts of letters, so sometimes the sentence may be incomplete. We have 20 seconds left. Pick your best answer. All right. So here we have 21 correct answer. Assess the patient suitability for MAT and initiate and manage the treatment would be the best option. HJ. It's on the lead there by Jeanette, Mike, Sammy, and Jojo. Who is going to win today's event, right? So assess the patient's sustainability for meds or medication assisted treatment, and if appropriate, initiate and manage the treatment, right? So that is the right answer for this question. Let's move on. So the patient reports decreased need for sleep, excessive energy, impulsivity, and racing thoughts. And the patient refused medic hospitalization. What would you do as a PMHMP? Okay, this one is kind of tricky, right? Very tricky. Because if someone is in manic state, they could harm themselves. But this one specifically did not say anything about the patient being a risk for himself or to others. So explain the risk of refusal hospitalization, document the refuse, and assess for safety would be the best answer. Okay. So very tricky this one. So when do you must admit the patient or initiate the process of admission when the patient is a dangerous to herself, himself, or others? In this case, it said the patient was manic, but not necessarily a dangerous. So very tricky, just borderline a tiny hair for patient admission, right? Okay, so a patient with depression and anxiety and thoughts of self harm, but denies having specific plan. What would you do? The patient vital signs and physical assessment are within normal limits. Which of the following actions should the PMHMP prioritize and manage this patient care? We have 10 seconds. Make your best answer. 5 seconds. Come on, let's do it. Bam, done. Okay, let me take a look here on the answer. Okay, initiating hospitalization referral due to the presence of suicidal thoughts, right? Explanation: the presence of suicidal thoughts, even without specific plan, is a significant risk factor for necessitating close monitor and possible hospitalization. Given this specific scenario with the patient with depression and anxiety, and the history given, right? Given the patient ongoing symptoms and occasional thoughts of self-harm, hospitalization may be required to ensure safety and provide intensive treatment. Okay, a little bit confusing question. I can see why some of you guys did not pick this answer. Okay, so he denies specific plan. Which of the following action is most appropriate according to the PMHP standard practice for the PMHP? The cue here is denies any plans. Okay, so here it was almost identical to the previous question, right? But it was very specific that there is no plans whatsoever,
But the
right?
question before that, they said they didn't have any specific plans. This one, they said they denies it, just a change in syntax, and it's a whole different answer.
Correct, correct. So the previous one I would have been more specific, saying that was occasional. This one I meant to say there is no plan whatsoever. So maybe the previous question could have been a little bit more clear. I agree with your rationale for sure. Okay, so thanks for that. But this one, the difference was I was trying to make between the both questions very identical, similar, very almost the same, but it was with one oscillating between yes, I do have a plan, no, I don't, versus another one from saying, hey, I do have suicidal thoughts occasionally, but I never had the plan. Okay, so it's one of those gray areas here.
So on the board,
There would be a little bit more clear than those two questions. I think here I'm trying to be just a tiny hair one way or the other, but I would hope that the board would be more clear in a context, as in occasionally having a suicidal plan, even though it's taking medication, versus, hey, the patient do have occasional suicidal ideation, but never had a suicidal plan or attempt on his life, right?
okay, so for the board, just because a person has suicidal ideation is not automatic hospitalization. It all hinges on whether they do or do not have a plan.
Absolutely right. You are absolutely right. Having suicidal thoughts, hey, I would argue that most people have had a suicidal thought at least once in their life, but not would be a very, very small percentage of the people that had suicidal thoughts and had the plan. Very big distinguish, right? If we had to admit everyone that had the suicidal thoughts, then we would be in a very difficult position right now. But you are absolutely right. All right, next question. Oh, do we have another questions on this subject? Okay, then we can move on. All right, so the patient had a trauma, right? Now express a desire to die. Which of the following action is consistent with the standard of practice for a PMHMP in this situation? We have 10 seconds. Pick your best answer. 3 seconds and go. All right. So everyone, most of you guys got it correct. So the difference here is it was a more, a more hard line, I would say. The goal of this question was to say, hey, the patient, has a possible plan, an idea that where he's going with this. So this is an immediate involuntary psychiatric hospitalization under the state mental health law, right? Um, just remember the Connor case, that the guy was in the hospital for 15 years when just due to mental health is not a condition for hospitalization. However, if it is a harm to her or to him or to others, that becomes a mandatory hospitalization. And then after that, the patient can request to go to court and plead his case or her case. It's very important to know the law cases that we have described in our course. Okay, every one of them is a possible question. Right, we have someone with schizophrenia, been taking the medications for a while, would like to discontinue the medication. What is your best action? How can you respect the patient's desires? All right, so in this case, you want to respect the patient's autonomy, but you also want to give it a full rationale for the pro and cons of this, in this case the risk and benefits of the medication or stopping the medication, right? At least the goal here is that the patient has a informed decision, that the patient can compare whether should I stop the medication, should I continue after having all the information in front of him or her, right? So engage in a collaborative discussion with the patient about the risks and benefit of the medication, explore his concerns and consider adjusting the treatment plan if it's appropriate. Remember, with Kahoot, I'm not allowed to do a complete answer, right? Because it doesn't allow me as many letters. So I try as much as possible to put something that at least is similar to a complete answer. Okay. So 19 years old that use substance abuse confines to you that he has started using drug again, but pleads with you not to disclose the information to his parents. What would you do? Would you tell or not tell? What if the parents are paying the bill? Does it matter? All right. So most of you guys got it correct. Respect the patient confidentiality and refrain from informing the parents is the right option here in this case. Okay. Sammy took the second place. So respect the patient's confidentiality and refrain from informing the parents unless there is imminent risk of harm to the patient, right? In that case, you may, depending of the state laws that you are providing care, right? Not every time either. So key point here. When dealing with Erickson stage, look at the age. If you look at the age, you most likely be able to match the stage. Is it trust versus mistrust? Initiative versus guilt? Autonomy versus shame and doubt? Or integrity versus despair? All right. Well done, guys. You guys nailed it. Good job there, right? So 8 players hit 4 streaks. So some people are getting correct all the time here, most of the time. So integrity versus despair. I want to call attention. Erickson stage. Look at the answer. Look at the stem of the question. Look at the age and match the age. We have a little formula in our course that you can easily memorize the age of the Erickson stage that will help you. I also advise you to put the Erickson on your dumping sheet, right? Because the Erickson can be one of those stages that can be confusing, especially when you're on question 130 or more. At the later part of the test, it can be a bit confusing. So put Erickson on your dumping sheet. We have 5 seconds. Pick your best answer. All right, so very good, right? Despite of the patient possibly not having the best outcome with the medication, you must respect the patient's autonomy, right? Or the principle that the patient have the right to make decisions about their treatment, even if those decisions are not in line with your medical advice, right? Respecting autonomy. I'll tell you, those ethical principles, you cannot just know them. You have to know them in details because they can be a little confusing. They all seem very, very simple until they come up with the question. So let's practice some more. It's a hard question, isn't it? Okay. All right, let's take a look over this one. This question, everyone, is all over the place. Let's take a look on the rationale. But before that, Jeanette's still on the lead, and Cherry took the second place there. So, discuss the importance of involve the parents with the patient, explore the potential consequence of not involving them, and attempt to gain the patient's consent to involve the parents in the care. I know this question, I couldn't put a very long answer, so but what I was trying to do with the minimum amount of letters that I am allowed would have been what is answer D here.
I
So it's a
get
very
wrong every time because one of the answers says consider safety first. So I pick that answer and I get it wrong every
yeah,
time. I mean, I would say,
yes,
yes, she's your patient, discuss it with her, but on a board exam question, safety first. But it was wrong.
yes, but remember the principle, the number one principle that I always say: read the question and ask yourself what is the question asking you, because those types of questions in which an answer sounds good, an answer is a correct statement but it's not answering the question specifically, will always in every question be a answer, especially in the dopamine pathways. There will be a bunch of correct answers there, it's just not answering the question. So a true statement, that's part of our strategy, that a true statement will always, or most of the time, will be one of the answers, but it's not answering the question specifically. Okay. So just try to practice that, asking yourself, what is the question asking you? What's the core of the question? And ask if the answer is answering the question. It's not just a true statement, but it's not giving you an answer to the question, so that cannot be the answer. But it was a hard one, and I tried to make it a little bit less hard, but the Kahoot doesn't allow me to do long answers. So long question, right? Is it autonomy, non-maleficent, beneficence, or justice? Take your best answer, 5 seconds, pick any answer, and go. All right. So it is justice here in this case, right? Justice, the definition of it is addressing the healthcare disparity and advocate for equitable access to mental health service for all patients, regardless of their background or immigration status, right? So ensuring that all patients receive equitable access to healthcare, that is justice principle. See, this is a good example how just knowing the ethical principles can get you in trouble. You really got to know them in detail. They can be very confusing at times, especially on the board. I promise you that one. We'll go back to this question if you have another question on this. All right, we have 4 seconds. Another difficult question, right? Another difficult question. Here involves the question said the history, his manic and history of making poor decision. So the goal here is autonomy versus beneficence, doing what's best for the patient, doing good for the patient, right? So the PMHNP should focus on promoting the patient's well-being and use strategies to engage the patient in a collaborative decision-making process regarding the medication. Okay.
I'm not
Very
seeing the difference there. I'm not. I got it wrong again because autonomy doesn't count anymore. Now you count beneficence. I'm not getting better at it.
yeah, this one was a bit difficult. I can see how you'd go for autonomy, right? Expecting the patient probing for the patient's own will of I wish I could just go back on the question, but I can't. It doesn't allow me. But I believe it was something about history of a poor decision. Here you have someone that's making a poor decision all the time when you have a risk of mania versus doing what's right for the patient, benefiting the patient in this case. So that was the two dilemmas that you have at hand, right? And these questions will almost always be borderline between one answer and the other. And that's why I said for those ethical dilemmas, you really need to know them in detail. Otherwise, they can be very confusing, although they sound and seem very simple at first.
Hey, Dr. Lopez, I have a question for you.
We'll go, I can't stop it, but we'll
Okay,
get back to
no
this in a
worries.
second. Save it, okay?
Sure, thank you.
This is a very common question, okay, with different medications. But just of the questions, you might see questions like this one in the board. Very common. All right. Before we go over this question here, let's go ahead and address the previous question that someone had. What was your question, man?
Okay, it was regarding the 16-year-old girl who had suicidal thoughts, self-harm behaviors, didn't want her family to know. And so the first best choice then, and the correct answer was that you discuss it with her, the importance of letting her family know, letting her, given the, helping her to see the importance of her family being involved in the care. And then at that point, if she refuses, then you must you have to report it.
I mean, yes, absolutely. Because if she is at risk for harm herself or others, then we, of course, if we want to gain the trust of the patient by saying, I think it's a good idea to have your family involved. But if she refuses, at that point, you have no other choice other than really involve the parents. Now, the same scenario, same circumstance, but the only thing different is she is dating someone of the same age or maybe a year older, right? And the
Uh-huh.
family do not want her to date anyone, whatever. So in that case, you would not report, right? Because
Right.
you want to gain the trust of the patient. And by not reporting, you are doing so. So at times, this condition will come on a board and it will be called the dilemma between doing what's right for the patient versus attending for the family, right? So the confidentiality versus attending for the patient's family is always one of those brown areas again, okay?
Well, I guess it depends on the severity of her symptoms. If it's a health and safety issue, a potential life and death issue, first try to get the patient on board with letting the family get involved, and then then you just have to report because it is a health and safety issue.
Absolutely.
Okay, great.
Thank
Thank
you for
you.
the question. So for this one, non-maleficence, I want to call attention for this question because it was a question that you might see this question with different medications. For example, let's say someone has a history of seizures, but it says that the only medication that works for him or her is Wellbutrin. Should you prescribe or not? Not, right? So non-maleficence is not giving the medication to a patient when the medication can cause some harm. So is the ethical principle do no harm. Okay. Same thing is for this medication in someone that had priapism, right? With can be Wellbutrin or it can also be trazodone, right? So same thing, same principle. Here it was with benzo. That's the only medication that ever works for me. But you know the patient had a history of self-harm or not doing well on this medication, right? So you do not give it, despite of what the patient wants. If you are having trouble with those, keep asking yourself and reading A through D and ask yourself what each one of those answers is it's about, right? It may be a little helpful for those principles there. We have 5 seconds. Pick your best answer and go. All right, done. All right, let's take a look here. It can be tough, right? So beneficence involve the action that promotes the well-being of the patient. In the case where a patient with borderline disorder express the desire to discontinue the therapy abruptly, the PMHNP should continue therapy to ensure the patient's safety and avoid worsening symptoms such as self-harm. This aligns with the principle of a beneficence, which focus on the patient overall well-being. Okay, let's take a look over here on the rationale for this question. Again, autonomy. So autonomy refers to respecting the patient's right to make their own decision, right? The PMHNP should involve the family in the treatment decision only with the patient is explicit consent, respecting the patient's autonomy while ensure that any involvement aligns with the patient's wish. Hard question, right? Because the family is saying, hey, this patient has made some poor decision, but yet we have to to give the patient, if the patient is an adult, the autonomy in this case, right? To involve the family or not. A bit of a hard question, right? So telehealth and the patient lives in another state. Okay. So what is the difference here between the yellow and the blue, right? So recommend the patient to seek in-person care from a provider in their state. Is that the does it answer the core of the question? So the core of the question was whether you can or cannot provide care since you are not licensed, right? And you know that you can't. You're not licensed on the state in which you are physically in, and the state has moved. Let's say I am in Florida, the patient moved to Texas, right? So I'm not allowed. So I have to stop providing therapy to the patient due to the lack of licensure. Okay. So the yellow option is a feel good option, right? A possible correct answer, but it's not addressing the issue here, right? So recommend the patient to seek in-person care from a provider in their state, right? So it wasn't the issue of being in person or telehealth. The issue was the licensure, right? Let's take a look on the rationale. So cease providing therapy to the patient immediately due to the lack of licensure in the patient state. Explanation: legal and licensure requirements must be adhered to, even if it means discontinue the care. The PMHNP must follow the regulations of the states where the patient resides. Providing therapy or prescription without appropriate licensure could result in legal consequences and is generally prohibited, right? So ask yourself, is the answer really answering the question? Long question here. Okay. So again, it's a case of licensure, right? You're not licensed to prescribe in that state, right? So the licensure is the critical in determining whether a PMHP can legally prescribe the medication. In this case, the PMHNP should comply with the regulation of the states where the patient now resides. Providing prescription refill without appropriate licensure would be against the legal requirements, making this the correct priority here. Do I have a question there?
Yes, going back to the patient with borderline, and she's wanting to discontinue therapy, the answer was beneficence, but why wouldn't it have been autonomy in that case? Because I
Right.
mean, you can't prevent a person from continuing on in your recommended treatment plan.
Right. So I think that that one specifically had a history of self-harm behaviors.
Uh-huh.
So I think that's what it was. I do not remember exactly the question. We can go back at the end and take a look again, but I think it was maybe self-harm behaviors in the past who had some indication of. So it could have been more of a safety issue as well.
So beneficence, to do good for that patient, you would try to talk her into staying in therapy, but ultimately autonomy at that point still has to rule.
Correct. Unless if there is safety issue with the patient, correct?
Okay.
Which I think in that question might have been a history of a suicide or a self-harm behavior or something along those lines, right?
Okay.
Okay.
Hi.
All right. So a bit confusing question, but most of you guys got it correct, right? So I'm glad that we didn't go in the details. What is the appropriate state authorities, right? And we didn't say if it was the police. We didn't say if it was the nursing board. We didn't. We just said appropriate state authorities, right? So we left for the reader to decipher what's the appropriate here, right? In this case, someone is at risk. You must communicate to the appropriate state's authorities. In this case, maybe perhaps the police, or perhaps someone that can intervene in a positive way for the patient at risk. Second. Okay. So in that case, it was a safety issue, right? And for that reason, the PMHMP should inform the patient about the limits of confidentiality, especially regarding self-harm, right? Most of you guys got it correct, but that one involved more of a safety issue. In that case, as we see the patient, we inform them when we should inform others, right? Especially regarding self-harm to self or others. All right, we have about 15 seconds. Pick your best answer. Okay, so everybody got it right. This one was a bit less complicated. So good job, everyone there. So the PMHNP should respect the patient's preference for psychotherapy and obtain informed consent for the treatment. So I just want to touch base on one important point. If you have a PHQ-9 and the score is 21, or the score is 17, or the score is 19, right? Let's say it's a high score. Your priority at that time is not to change the medication. Your priority is not to increase the dose. Your priority at that time is to assess for suicidality. Okay. You might see a question in which the scales have changed from either increase or decrease, and they may ask you, what should you do next? Almost baiting you to increase the medication or decrease the medication when the answer is to assess for safety, especially if it's increased, especially with suicidality, okay? Major depressive disorders and suicidality. Okay, so very good. So questions like that in which I would I don't want to say every single time, but questions in which it specifically says, hey, the PMHNP is aware of the Tarasov principle in their state, most of the time it's convenient to you that it is allowed to say it to the possible victim, right? So contact the law enforcement. It's almost every time the correct answer, or the potential victim, to warn them about the threat. Now, if it's if it doesn't give you like this warm feeling that you know that the PMHNP has is knowledge of the Tarasov principle, do not fall for, hey, I should contact the possible victim, right? Because the Tarasov does not apply to every state, and the board is national. Okay, very borderline how these questions can go. So you have to really practice many as possible. Okay? That's why we have a huge question bank, right? Over 1,000 questions to be able to discern those questions. All right. So this is another question that you should know what the PICO letter stands for. If you get it wrong here, that's a blessing in disguise, because you should know what PICO stands for. It's a very important acronym that you may see on the board, as well as CAGE. Let's take a look here on the answer so we can see exactly what PICO stands for, right? So problem, intervention, comparison, and the outcome. And sometimes they say PICO T or PICO, right? So the T is for the time or the time frame. So PICO is acronym that helps structure research questions in evidence-based practice by defining the elements of the study. You should know what PICO stands for. It's a very important acronym. So problem, the condition being studied, the intervention, the treatment, or the exposure, the comparison, the two groups being compared, the control versus the other group, and the O for the outcome, the results that we're looking for. And the treatment is the duration of the study. A good example how we seen the question and the similar, almost identical question will come up with very little difference. And let's see if we can get as many people getting the correct answer. You have 2 seconds, go. Okay. So population intervention. Oops, I misspelled that. So let me take a look here. Population intervention, comparator, outcome, and the time. Comparison would have been the correct terminology there. Almost the same thing. Comparator is the control or the alternative to the control or alternative, right? The outcome expressing the results and the time, the duration of the study. Guys, Pico and Cage, you should know. Write this down. Pick your best answer, 30 seconds. That's another type of a question that you should know. 6 seconds, give me your best answer and go. All right. So very close between level 2 and level 1, right? So this is a level 1, so it's considered the highest standard and includes systemic review or meta-analysis, right? So very a bit different than just a well-controlled randomized controlled trial, right? So this one, I think the question mentioned looking at several of the articles or something along those lines, and that's is for the main difference between evidence 1 and evidence 2, right?
Dr. Lopez.
We'll get back to you just a second. Let me just finish here. So in third place we have Spicy. Second place we have a HJ, and the winner of today's event is Janet. Janet, you win again. I think you won the previous week and the week before. You are on the roll. Good job there. All right. Very good job, Janet. If you keep playing, I bet I'm going to owe you some money, you know? So keep adding those points. Good job there. Let's go ahead and answer your question here. Go ahead, please. What was it? Someone had a question. I could not see. Who was it?
Yes,
Go ahead, please.
So I think the last question about level 1, level 2, you might want to review that question because it says that the sample group, one of it just says a large sample group, like in insinuating like is in only in one study. So if it is just in a study and other things, that goes to be like a level 2. You can put that question so I can.
Did they say there was only one study?
Yes, you say a study, a study.
I can't go back. Let's take a look at over that question one more time. Let me see if I can go back.
Okay.
See, that's one of the things with Kahoot. At times, it does not allow you to go back, but I can't go back to that specific question. I believe it only said a large sample group, but it wasn't referred to one study. It meant to refer to several studies, right? But let's take a look at it. All right. So let me go back now. We can read the question in a little bit more detail and take a look at it. How, if we could select a different answer. So here is the question. Can you guys see it? No, not yet, right? Okay. So a PMHNP is conduct a literature review to gather the evidence on the effectiveness of different pharmacological intervention for treating major depressive disorder in adolescents. While reviewing research articles, the PMHNP come across a study that has undergone rigorous peer review, include a large sample, and employ double-blind placebo-controlled trials. What is the most appropriate level of evidence of this study according to the hierarchies of evidence-based practice? Giving a little bit more time in this convoluted question, would you still pick evidence 2 rather than 1?
So let me make sure I'm not reading into it.
Okay.
So it says here, a study. So why
We'll start from the beginning. A PMHNP is conduct a literature review to gather evidence on the effectiveness of pharmacological, anyways, major depressive disorder in adolescents. While reviewing research articles, the PMHNP come across a study that has undergone rigorous peer review, including a large sample size, and employs double-blind placebo-controlled trial. So it has collected several articles and come across one that that meets probably if you look at only at that one would be most likely evidence 2. But I have several articles on my table, but one has the strongest evidence. What is the most appropriate level of evidence of this study according to hierarchies of yes, I can see why the question is a bit confusing because it's almost insinuating is only one study of several studies. And that's your point, correct?
Yes, that's what I'm saying.
Yeah.
Yeah.
So the question could be a little bit better written for sure. The point was to be a bit convoluted, but I have 10 studies here. One is the strongest study that has gone through all this extra stuff. But when you analyze a systemic or meta analysis, I'm going to pull together all the studies, I'm going to run some numbers, and I'm going to publish the results, right? So the question could be better written. What is the most appropriate level of evidence of the studies according to the hierarchies of evidence-based practice, rather than saying for this study, insinuating there was just one of the few, and we were referring only regarding one, right? So I give it to you. If this was in my school and the student complained about this question, I would throw it out. I would give it the point away. Uh, yeah. So the main point here is that they are very close between level 1 and level 2, right? If the question would have perhaps asked what's the most appropriate level of the evidence according to the hierarchies of evidence-based practice, and taking away the of this study or of these studies, right? Just leaving blank, you would go and assume that all the studies that had been done.
Correct.
Thank you.
Thank you so much for the explanation. Thank you.
Absolutely. So uh let's go ahead and take a 10 minutes break, and then we'll come back, answer a few more questions that you guys may have for the week, what you've gone through of the studies, and then see if we can clarify anything else. Okay, so it is now 7:30 p.m. Eastern time, I would think. So let's come back at 7:40. I'll see you guys soon. Okay, and please write it down your questions so we don't forget, and we'll go over anything that we may be missing.